Today we're going to introduce you to a facility many people are going to be surprised to know that exists right here in Northern Nevada. This is Mars Casal with WellCare. Thanks for having us.
Thanks for coming.
WellCare, what are you doing? Who do you provide services for? What services do you provide?
WellCare's been around for a couple of years, but for the last year, we've been here in Northern Nevada providing services to the behavioral community. Our goal has always been to reduce the fragmentation of care for this population. And we're excited because we were able to create a company that encompasses all of those services under one roof. And those services include psychiatry, pharmacy, family practice. We have case managers here, we have therapists here, and we also provide transportations for our members. We collaborated with a managed care organization, AmeriGroup, to provide these specific services for their members.
I can't wait to take a look around.
Sure.
You offer both primary care and women's health here at WellCare.
Yes, we have a team of medical providers that provide primary care services, things like basic health screening, management of common health conditions, as well as comprehensive women's health services, including breast and cervical cancer screening, management of pregnancy and postpartum, and basic contraception services.
A lot of people are going to be excited to know that you offer medically assisted treatment programs for those with addictions, including Vivitrol and Suboxone.
Yes, we do offer those for folks who are needing more support in their recovery. We also offer psychiatric medication management for individuals needing a little bit more than just individual therapy and case management.
I think one of the services you provide is extremely important, which is that you have a dispensary on site. I can imagine many times people that don't have transportation to go fill these prescriptions will go without them.
We do have an on-site dispensary where we carry the most commonly prescribed medications, and clients can come in and see their psychiatrist, their primary care provider, their women's health provider, and in most cases leave here the same day with their medications so that they don't have to later make a separate trip to the pharmacy.
Tell me about the therapy services that are available here at WellCare.
We offer individual therapy for people in the community, either in programs or out of programs. We deal with depression, anxiety, trauma, PTSD, and also kind of specializing in co-occurring disorders, which is clients who have mental health disorders paired with substance abuse. We have group therapy sessions that are about 1 hour, and then we also have IOP, which is intensive outpatient therapy.
Tell me a little bit more about intensive outpatient therapy. How does that work?
Intensive outpatient therapy are groups that are offered 3 times a week, 3 hours a day. They are able to take breaks in between, but they focus on specific topics and different things that clients might be looking for.
Tell me about your case management services.
Our case management services are very integrated. We meet with all of our members at least 1 time per week. Usually it's more like 3 to 5 times per week. We'll sit with them at the DMV. We'll sit in with their psych appointments. We will do everything that it takes to help them be better and successful.
For people that don't know this facility even exists in Northern Nevada, this is PUF. What is PUF?
You know, PUF is the Psychiatric Urgent Facility, and what it is a drop-off resource center which allows members to be able to be linked to services that WellCare services provide. It's kind of unique in a way that it's really a cost-effective program, but its main goal is really to help those members or homeless individuals be linked to services to create that road to recovery.
What it also does is bridges the being released from the hospital and actually finding housing.
So what historically happens is people use these hospitals as a form of shelter, and even though they don't meet criteria, simply because they need some form of respite and food. So what we've created here is a facility where they can get these resources, and it's a cost-saving program so we can save taxpayers' dollars and hospitalization rates.
You're able to provide a real bridge in temporary housing as well for these individuals while they either access other programs, but you have some facilities of your own.
Yes, we provide temporary transitional housing to allow to stabilize that individual and be able to begin their process of being linked to services, whether it's social or medical needs. They can now start to see psychiatrists, family practitioners, therapists, case managers that will help them if they have social services needs such as food stamps or rental vouchers. Our program is able to assist, and this is the entry point where they can be introduced to those services. We have a 30 to 50 bed facility, and members are able to live there for a short period of time as they continue to get the treatment that they need. So this is our respite center at the PUF. This is a cost-effective alternative than the emergency rooms that allows members to come in here. They could sleep, they could decompress, while we process them and connect them to some of our services at our medical facility next door.
I understand that you're a client at WellCare and that this program has made an extraordinary difference in your life.
To say that would actually even be an understatement, because I would not be alive today if it was not for this program. I've been actively battling alcohol addiction and drug addiction for the past 20 years. I've gone to therapists, doctors, treatment centers, acupuncturists, clergymen, everything I can think of to beat this disease. And I had finally reached a point where there was no way I was going to beat it.
And yet this program changed that for you. What happened?
A very dear friend of mine got me into an inpatient detox program, and it was there that I remember laying in bed and just desperate for hope. And one of the staff came over to me and said, "Have you heard of this program called WellCare?" And I'd researched every program I thought known to man. And I said, "No, I have no idea." He said, "Well, hold on, let me look into it for you." And then a few hours went by, and then I was sitting at the table biting my nails. I mean, he came and he slipped this note to me that said, "The angels are coming, pack your stuff." And then WellCare came and picked me up from the facility. It's never happened before, because every time I've checked out of a detox unit, there's that scary gap where you're like, what do I do next? And then panic, and then oftentimes you relapse because you're so scared and you're not sure where to go or what to do. And then WellCare was there, and they've been with me ever since. That was 6 months ago.